India's daily COVID numbers jump by over 14% as the country reports 43,263 new COVID cases, 338 deaths. The World Health Organization calls for countries to avoid giving out extra COVID shots until the year end, pointing to the millions worldwide who have not received a single dose yet. And South Korea COVID cases are at record highs as the country looks to relax virus restrictions. Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. Today on the show, we're not going to discuss coronavirus first. We're going to discuss the increase in viral fever cases in dengue that have been seen in different parts of North India. After Uttar Pradesh reported a major spike in cases of viral fever, dengue and malaria, with Firozabad emerging as a major hotspot. Now reports of cases of viral and dengue rising in Bihar and in Delhi as well. In Bihar, a surge in viral fever cases among children has been reported in several hospitals in Patna. In fact, the number of children affected with viral fever is also rising in other districts, though it's not a crisis situation in hospitals, but it is a cause of concern. Doctors in the National Capital Region are also seeing an increase in cases of viral infection in children, also dengue cases, and they have blamed the seasonal influenza for the surge in infections. In fact, a survey by the community social media platform Local Circles has indicated that 10% of households with one or more members who are currently down with flu-like symptoms on the 21st of August was around 10%. So on the 21st of August, it was 10% of people according to the survey. And then within 2 weeks, on the 1st of September, this rose to 34%. So that was a 240% rise in flu cases in 2 weeks' time. And with households saying they had one member down with a flu. Well, to talk more about the survey, we're joined by Sachin Taparia, co-founder and chairman of Local Circles. Sachin, if you could just share a bit about this survey that was done. And of course, UP cases of viral and dengue have been in the news, and Firozabad, as we said, is a hotspot.
Of course, Gargi. So we were seeing, people from Uttar Pradesh and Delhi and even Haryana starting about, 15th of August, talking about rising number of cases of viral fever. And at that time, people did not know what it was in all these three states. So we did a survey in Delhi around the 21st of August, where 41% people, basically 41% households had one or more member who was sick and down with, fever or fatigue or symptoms of viral fever. In UP at that time, the number was 10%. When we did this survey again over time in 2 weeks in Uttar Pradesh, that number shot up from 10% to 34%, which is basically 1 in 3 households has one or more individuals who are down with such symptoms of fever and fatigue and cold and cough. In Delhi, I'll also share, we are just releasing another report on Delhi. The number actually has come down from 41% to 28% just now over the last 3 weeks or so. So I think it is now trending in the right direction. We just need to ensure that it continues to see that improvement in Delhi, and right. The situation also improves in Uttar Pradesh too, where it's still quite a big concern.
Right. And Sachin, given that we're in the midst of a pandemic, when you see these sudden increases in cases of fever and infection, then of course also COVID is something that crosses the mind. So a lot of the people you surveyed had got their RT-PCR test done or got their COVID test done to check what this infection was?
About 20 to 25% of individuals, Gargi, basically, this is how the concern started, that people started asking in the online communities on our platform, as to if others were seeing something like this, and should they go for an RT-PCR test. So I think that was the first genuine concern in a lot of people's mind early on. But I think now more and more people are coming to terms that this is more of a seasonal viral or, one of the vector-borne diseases. One of the other concerns, Gargi, which has been prevailing is the whole, mosquito control situation in the country that a lot of people are concerned about, and the lack of fogging activities by municipal corporations or panchayats at this time of the year, which is supposed to be done in a more planned and organized manner, is not happening. So I think that is something that people are very, very concerned about.
We're seeing the rise of these vector diseases. We're also joined by Dr. Suresh Kumar, Medical Director, LNJP Hospital. Thank you so much, sir, for joining us. We were just talking to Sachin about a survey that was done in which it was found in UP that households with viral infection had increased from 10% to 34%. We're also seeing cases in Bihar of viral and dengue, and in Delhi as well. In NCR, we are seeing a rise in the number of cases, or we have seen. What can you tell us, Dr. Kumar? What are you currently observing?
Thank you, madam. We have seen that over the last 1 week, we see large number of patients coming to attend the OPDs. Every day, we have more than 100 cases of fever with sore throat, with viral-like symptoms. And we have seen that some of these patients have simple viral fever, others have dengue, or sometimes we have the other vector-borne diseases like malaria. So trend is there all over North India that large number of patients are reported in the OPDs and in the clinics, and also we have admitted few patients.
Right, doctor, as you said, the trend is there in North India because, yes, yesterday we talked about how Bihar is seeing an increase in cases. Hospitals in Patna are seeing a lot of children especially coming, reports from district hospitals as well. We've already had the case in Uttar Pradesh, in Firozabad, where we've seen such a crisis in terms of the hospital. So obviously all this raises concerns because it's happening in the midst of a pandemic. And, doctor, every time there's a fever and cough and cold, it raises alarm bells. What have you seen in your patients, and how do people tell this apart, that it's not COVID, it's just a viral fever or dengue?
So we have to differentiate between simple viral fever and those viral fever with the alarming symptoms. If you have alarming symptoms caused by dengue virus, if you have the bleeding, if you have the swelling in the abdomen, if you have the diarrhea or vomiting, and you have severe symptoms, that is the alarming sign. And if you have, for example, COVID virus along with the dengue, then you have to be more alert. If you have the, we have seen few cases where the COVID and dengue virus, because both are the RNA virus, and we have seen the clinical spectrum is worse and outcome is also poor if both these viruses are seen in the same patients. And there are many studies from Indonesia and other part of Southeast Asia where this COVID plus vector-borne disease and virus like dengue are seen. And now we have seen many case reports that few of the children actually have the dengue-like symptoms and tests are normal. So we have to be more careful that once we have the clinical suspicion of the high-grade fever, severe symptoms, alarming symptoms, then that has to be differentiated, because most of these patients don't require hospitalization. But if you see the patient with the alarming signs, then clinicians or doctor has to admit these patients, and at the same time the test has to be ordered to see the overlap of the diseases. Like we have seen many patients with chikungunya, many patients with malaria, many patients with the other seasonal diseases like typhoid.
And doctor, is it different this time
around? These have to be differentiated from the viral illness.
Sure. And is it different this time around? Are you seeing more such cases? Can we? What is the understanding of it? Because in UP, it's just been huge number of cases, and especially children getting affected.
We have seen reports that more children are infected, and many of these actually have the dengue. Because if you have the skin rash, if you have the low platelet count, if you have the high-grade fever, and if you have the, we have seen few cases in the UP reported as a scrub typhus, meningoencephalitis. So these type of fever are very difficult to diagnose, and the government of India has given clear-cut direction, clear-cut guidelines to see all these 6-7 diseases, whether it is a dengue or corona
And what is
or
hemorrhagic
you have
dengue?
the
If you could just
chikungunya.
explain.
You have to order all these tests, and you have to identify the patients depending on the clinical presentation.
And why is it a more severe type of dengue that we're seeing? Because that is what the central team said. They described it as a hemorrhagic dengue. Yes.
Every year you have different type of serotypes. The dengue virus is of 4 types: type 1, type 2, type 3, and type 4. So every year the new infection is emerging, and different virus is responsible for dengue. If 2 years back it is type 2 or type 3, this time it may be type 4. So if you have 2 virus and second virus, infection is always more dangerous than the initial one. So that may be happening because the virus itself is changing. Every year, the new virus is emerging. That may be the reason for this different clinical presentation and more severity and more these deaths which are reported in the Bihar and UP.
All right, so we're seeing this rise in cases. Thank you so much, Dr. Suresh Kumar and Sachin, for joining us on the program to talk about this.
Thank you, ma'am. Thank you.
Thank you.
And now a look at why the Delta variant of coronavirus is dominating in different parts of the world. Now, there was a 6-fold drop in the ability of antibodies from a past infection to neutralize the Delta variant, and a greater 8-fold reduction in the potency of antibodies elicited by the vaccines, according to a peer-reviewed study led by researchers from India and the UK. The study combines findings from lab experiments and analysis of breakthrough cases to piece together signs of the Delta variant being better at replication and resisting antibodies. It also cites lab analysis that shows the Delta variant to be more efficient in entering human cells and replicating within. Well, to talk more about this study that is peer-reviewed, we're joined by one of the authors, Professor Ravi Gupta from the Cambridge Institute of Therapeutic Immunology and Infectious Diseases. Thank you so much for joining us. And Professor Gupta, tell us about the findings in this study that's been published in Nature on the Delta variant.
Yes, we undertook a really detailed investigation of Delta in collaboration with our colleagues in India, spanning a number of institutions, including INSACOG. And the key there really was to understand the biological characteristics which can explain the global dominance of this variant. And we found, in short, that this virus has extremely high replication ability. In other words, it is able to reproduce itself very effectively in large numbers and large quantities. And this contributes to increased infectiousness. And the way that it does this, we found, is that when the virus makes the spike protein, which is sitting on the surface of the virus and is responsible for engaging and entering a target cell, that spike protein is in a processed form, in a very mature form, in a very infectious form. In other words, it's kind of pre-prepared. It's much more ready to cause an infection than the typical SARS coronavirus spike protein. So it has evolved in a way to become more infectious, to be more able to enter cells. And we found that this was a very significant advantage over the Alpha variant, which emerged in the UK and spread to India and other countries. It was much, much more efficient than the Alpha variant. And in addition, when we tried to challenge the Delta virus with antibodies from people who had been vaccinated or infected before, those antibodies were not able to very effectively deal with the Delta variant. So there was some degree of immune evasion, we say. The immune system has been avoided to some extent by this Delta variant because we believe the Delta variant emerged in a patient who presumably had some kind of immunity but was unable to clear the virus, and the virus acquired more and more mutations to enable it to become fitter, in other words, replicate faster and avoid antibodies.
So that's very concerning that antibodies from a previous infection are less effective in preventing illness from the Delta strain. And what does this mean for India, given that we had such a severe second wave?
That's right. So what we believe in because of the Delta variant findings we have reported, is that this explains why so many people were reinfected probably in the earlier parts of this year with the Delta variant, causing such severe disease and death in so many people. And of course, that evidence is there is evidence for that, because we then describe in the paper infections in healthcare workers who were all vaccinated, and they all were infected with the Delta variant despite being vaccinated with 2 doses. And that was a very worrying finding. Of course, none of them became very ill or died, but they could have all passed on this infection to somebody else. And that is telling us that this virus can infect people even after vaccination. You should still be vaccinated because it protects you against dying from this disease, which is critical, obviously. But it means that we have to think again about how we successfully control the transmission and spread of this disease.
And so what does this mean about, regarding our understanding of herd immunity, something we've heard since the start of this pandemic, that we have to achieve herd immunity, but clearly the virus keeps circulating among the population, even if vaccinated.
Yes, I mean, herd immunity, I don't think it has a really stiff, fixed definition. Ideally, it means that you're immune to infection and transmission. I mean, that's the purest way of saying this. You are immune to, you don't get infected and you don't pass it on. That's the solid definition. A more relaxed definition would say, okay, herd immunity means people are protected from severe disease and death. And that still allows for onward transmission, which means that you can be more relaxed about the definition. And that's what many countries are interpreting it as, because they say we can't continue functioning as a society or economy if we still count all these transmissions in mild infections as severe. So they're saying, so the definition is changing in a way, but I think everybody agrees that herd immunity is something that's much more difficult to achieve now, mainly because we don't vaccinate children and young adults, and they are 20%, 30% of the population. So we're never going to get to anywhere near herd immunity unless we start vaccinating younger people.
And now we have new variants emerging. It's not just Delta. We're hearing about the Mu variant and C.1.2, and WHO has also spoken about these new variants.
So these variants have a number of mutations that have been seen before. They have some new mutations. It's difficult to know what they're actually going to do because, I mean, Delta showed us that it's not all about immune escape. Delta has spread so quickly and unpredictably because of changes that we didn't understand. So I think it's very hard to predict what new variants are going to do until we see them in action. And from my point of view, nothing has come close to what Delta is doing. So I think that whatever we're seeing in other parts of the world, other variants, we should be focusing really on Delta right now because this is the one that is causing the biggest problems.
And that's what we're seeing, isn't it? It's because of the Delta variant we're seeing these, crises in Israel where they have such a good coverage of the vaccine, in the United States as well, though that's because of a lot of vaccine hesitancy there.
That's right. So we really, unfortunately, are in a situation where despite the vaccine, we still need to be very cautious of what's going on. We still need to exercise care. We should not really be doing large gatherings of thousands of people, ideally, even if it's outdoors, because there can be transmissions. It's a highly infectious virus. And so we're really in a difficult position right now. The best thing we can do is vaccinate as many people as possible, as quickly as possible, in order to get transmission under control.
All right. Thank you so much, Professor Gupta, for joining us on the program. Well, it's time for us to slip into a short break. Coming up on the other side, why the WHO has asked rich countries not to give out booster shots just yet. Welcome back. Well, let's now focus on Europe, where it's back to school time across Europe, and coinciding with the return to classrooms amid the still ongoing pandemic, Germany is relaxing quarantine measures for in-person learning. For more on this, let's go across to DW correspondent Nicole Frohlich as she joins us from Berlin. So, Nicole, how is Germany planning to deal with COVID in classrooms in this new school year?
Germany is working to mitigate the disruptive effects COVID has been having on children's lives, especially when it comes to education. Until now, there hadn't been a unified strategy, though every state and every city had their own way, which led to a very confusing overall scenario. So now state leaders have agreed on a joint way forward to avoid chaotic dips in and out of quarantine of entire classes every time one of the pupils contracts COVID. Only close contacts of the infected child will have to self-isolate. Vaccinated children won't have to quarantine at all, and that is a similar approach to the one we're seeing in France and Spain, for example. But the situation becomes a little more complicated in kindergartens and primary schools, where it's a lot harder to enforce health protocols. Plus, kids under 12 cannot yet be vaccinated in Germany, so it's a step forward, but probably not the last adjustment of the strategy here.
And this, of course, affects families and teachers, policymakers. How has this decision been received?
Well, any debate involving children and COVID is bound to be a heated one, and this one is, of course, no exception. Some medical associations say that this is more than enough and that the dangers of a COVID infection for young children are acceptable compared to the damage inflicted by continued isolation. Parents and certain politicians, though, accuse the new guidelines of being oblivious to the dangers of more aggressive variants, and some are even calling it a violation of the children's bodily integrity. Educators, too, are not too happy. Many say this new approach is too short-sighted. They complain that we're heading into the third pandemic school year without a realistic contingency plan on the table, especially for institutions where enforcing COVID guidelines is more difficult, like schools for children with special needs. They are wary of seeing people make the rules who appear to not understand the dynamics of the educational environment and are now pinning their hopes on more kids getting vaccinated rather than leaders making sound decisions.
All right, Nicole, thanks so much for joining us with that. The same debate everywhere about schools reopening. And finally, the World Health Organization called for countries to avoid giving out extra COVID shots until the year end, pointing to the millions worldwide who've yet to receive a single dose. Speaking from the WHO's headquarters in Geneva, Tedros urged wealthy countries and vaccine makers to prioritize getting the first shots to health workers and vulnerable populations in poorer nations over boosters. Last month, WHO asked for a moratorium on COVID vaccine booster shots until the end of September to address the drastic inequity in dose distribution between rich and poor nations. Now they've asked for it till the end of the year. Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.